Hello everyone, my name is Dr. Aubry, and if you're watching this video, then you're very concerned about something called peripheral neuropathy. So what we're going to do here today is I'm going to talk to you probably for about 25 minutes or so about peripheral neuropathy, what it is, and some options that might be available for you in order to help you or somebody you love get over this hump and deal with this problem called peripheral neuropathy. Now what we're going to be talking about is functional neurology and functional medicine and the approaches that those have in order to help people that are suffering from peripheral neuropathy. Now I want to talk to you a little bit about myself. My name is Dr. Aubry. I am a chiropractor. I practice in South Burlington, Vermont, and I have been in practice for about 15 years. I am also a board-eligible chiropractic neurologist. I have a postdoctoral certificate from the American Functional Neurology Institute. I am also board certified in integrative medicine. I also sit on the board of the American Association of Integrative Medicine, and I'm the author of an autoimmune book that's going to be coming out in the fall of 2014. So what is peripheral neuropathy? Who suffers from this? What causes it? And what can be done in order to reverse this or to help the symptomatic effects that are there from something like peripheral neuropathy? Well, first and foremost, peripheral neuropathy is something that is extremely common. It's a chronic disease that affects over 20 million Americans. Now, what ends up happening is the electrical wiring that's in your body, your nerves, are starting to break down. They're not able to communicate with other parts of your body. Your feet, your hands start to have problems. This starts off in the most distal or the furthest away from your body. So the smaller, tiny little capillaries, the blood vessels that are in the ends of your fingers and your hands and also in your toes are the ones that are going to get affected first. So what ends up happening is the brain then can't communicate with your hands or your feet. Now, what exactly does peripheral mean? Well, peripheral means further away from the body. When we're dealing with something like our central core here, peripheral neuropathy means away from the body, so more distant or distal away. Neuro itself means nerves or having to do with the nervous system, and pathy, like we hear about pathology all the time, means abnormal. So we have abnormal neurological compromise that's going on throughout your body. There are 10 signs of peripheral neuropathy. Go ahead and take out a pen and write these down because these are extremely important. So first and foremost, what we have is numbness. Then we have burning feet, cramping, sharp electrical pain, pain when walking, difficulty sleeping. You're going to get some people that are saying they have restless leg syndrome. Well, restless leg syndrome is a form of peripheral neuropathy. You also might have some prickling or some tingling feeling in the feet. There's also the possibility of having a loss of balance. If you can't feel where your feet are in relationship to the ground, then you're putting yourself at a huge risk for falls. If you're not aware, the number one cause of death for the number one cause of death for people over the age of 65 are falls. And the reason why these people fall, it's not because their legs just give out on them. It's because they can't feel where their toes and their feet are in relationship to the ground that they're walking on. And when that happens, what's going to happen to you is you're going to put yourself at risk for injuries. First of all, falling downstairs or tripping on something, but also for walking and maybe stepping on a tack or a nail that can also cause an infection because you can't feel where your foot is. This is extremely worrisome for people that have peripheral neuropathy. You might also have some weakness and some swelling as well in the distal extremities. Now, your symptoms are going to depend on the type of nerve that's affected. We have different types of nerve. We have nerves that carry sensation. These are called sensory nerves. And then we have nerves that are going to help us to move. These are what we call motor nerves. So we have a third kind of nerve that's called an autonomic nerve. This has to do with our autonomic nervous system. So this is going to be pertaining more to the blood and things that are dealing with our internal organs and carrying those messages from there to the extremity. Now, when we start to see damage, we see changes with sensory fibers in sensation, burning sensation. You might have some nerve pain, tingling or numbness, or inability to determine your joint position. This is what we were just talking about. So you're going to put yourself at risk for falls. You're going to put yourself at risk for serious problems in the future if you do not address this problem right now. For many neuropathies, sensation changes often begin in the feet and progress towards the center of the body. So there's also an involvement of the internal organs. We can't just think about this as something that is bothering our feet. If it's bothering the feet, then those nerves are being affected, but it's also going to affect our internal organs as well. Now, damage to the motor fibers that deal with muscle control can cause a weakness, a loss of muscle bulk, a loss of dexterity. Sometimes cramps are a sign of motor nerve involvement. Now, all chronic conditions are going to have some common threads. So when we're looking at some of the chronic conditions that we deal with here, whether it's peripheral neuropathy, thyroid conditions, insulin resistance, diabetes, fibromyalgia, vertigo, sciatica, hypertension, stenosis, irritable bowel syndrome, all of these are going to have some metabolic imbalances. So we might see some things like anemia, we might see some chronic inflammation, unstable blood sugar levels, adrenal gland dysfunction, autoimmune attacks, hidden infections. You might have viral gut infections or bacterial infections, medication side effects, or a lack of oxygen, which is what we call hypoxia. Now, all chronic illnesses are a combination of neurologic and metabolic problems requiring proper neurologic treatment and metabolic treatment. If we just treat one without the other, you are not going to get the maximum benefit. We have to realize that the brain is driving that whole metabolic system. Your brain is going to drive your entire endocrine system. That starts off going down through the thyroid and the rest of your endocrine system and the rest of your entire metabolic system. So if we're not dealing with both the neurologic and the metabolic part, you're going to be doing yourself a disservice. Now, what exactly is metabolism? Well, when we're talking about something like metabolism, what we're doing is we're actually taking food, we're taking those calories and we're converting that into energy. Now, I have a question for you. Take out a pen and paper and write this down. 30% of our energy goes to which system? Is it the endocrine system, the digestive system, the nervous system, the immune system, or the cardiovascular system? Which one do you think it is? Well, the answer is, it's our nervous system, our brain and our spinal cord. We need proper metabolism, we need proper energy, and for a well-functioning brain and nerves to work. Metabolic problems lead to peripheral neuropathy. If you're not getting the right amount of nutrients into your body, if you're not getting the right amount of supplements, if your body is not able to break these things down and utilize the type of nourishment that you're getting into your body, if you're not able to utilize that energy properly, then that is going to lead to nervous system problems. That's going to lead to metabolic problems. And the problem that we're going to end up having here today is peripheral neuropathy. Now, let's go over some of the leading causes of peripheral neuropathy. First and foremost, what we have are what's called statin drugs. You might be diabetic, you might not be. A lot of the people that we see for peripheral neuropathy are in fact diabetic, and when they go to see their endocrinologist or their internal medicine specialist, they might have been put on statin drugs. This is something that's been pretty common over the last 20 years or so. There's a problem with statin drugs. Statin drugs are going to cause peripheral neuropathy. You might have a damaged back. Maybe you have some arthritis or stenosis. Maybe there's a bulging disc where you're involved in a car accident and now all of a sudden, a couple of years later, you're not able to feel your toes or your hands. Maybe there's something going on there because of that bulging disc that's irritating the nerves. Now, if you're diabetic, whether it's type 1 or type 2, eventually what ends up happening is you do suffer some form of peripheral neuropathy. Not everybody is going to have the worst case scenario where you can actually lose a limb, but there is always going to be something associated with diabetes with regards to peripheral neuropathy. It's very important to keep those blood sugar levels stable. Chronic inflammation. That's the one major cause or the one major problem that we see across the board with all autoimmune diseases. Inflammation. When we're talking about inflammation, we're not talking about taking a hammer and smashing it on your hand. What we're talking about here is a chronic inflammatory response throughout your entire body. That inflammation can come from food sensitivities, it can come from specific inflammatory foods, it can come from hidden infections, poor omega-3 to omega-6 essential fatty acids, high insulin, and hormone imbalances. The next cause of neuropathy can be caused by chemotherapy. Now, let's talk a little bit more about statin drugs. So what statin drugs are going to do is they're going to inhibit the formation of cholesterol. Cholesterol is actually extremely important. We have this misconception that cholesterol is a terrible thing. We actually need cholesterol. It makes up the outer sheath of the nerve. So if you don't have enough cholesterol, those nerves aren't going to be functioning properly. It's more important to look at your cholesterol ratio than it is to be looking at your specific cholesterol number and whether it's high or low. Statin drugs are also going to inhibit the formation of coenzyme Q10. This enzyme is extremely important. It's vital for heart function. So if you're taking statin drugs, you're going to be deficient in coenzyme Q10. Coenzyme Q10 is extremely important for the nerves to function. Now, statin drugs are one of the leading causes of peripheral neuropathy. It interferes with serotonin receptors in the brain as well. There was a recent comprehensive study done at the University of California in San Diego. Most of the doctors through this study, what they noticed was that they dismissed complaints that their patients had about having peripheral neuropathy from statin drugs. They didn't even report them. So all of these things were pushed by the wayside when they were saying that the statin drugs are causing problems, but they didn't even keep all those records. Now, statins are going to increase the risk. A study from the Neurology Journal, May 2002, states that statin and cholesterol drugs increase the risk of peripheral neuropathy by 16 times. That's 1,600%. If I told you that I would give you something to increase your risk of having a problem by 1,600%, would you take that? Would you take it if it doubled your risk? This is crazy. 1,600 times. Now, is cholesterol really the enemy? Well, why has heart disease gone up dramatically since statins came on the market? Is there a direct correlation between cholesterol and heart disease? Why do countries with chronically high cholesterol have lower heart rates and heart disease? Why do just as many people with low cholesterol die from heart attacks as many with people with high cholesterol? What is the main reason that people are having heart disease? Is it in fact cholesterol? Well, no. A great book that you can read is what's called The Cholesterol Myth. This was written by Dr. Stephen Sinatra and Dr. Johnny Bowden, and it shows some great insight into cholesterol and statin drugs. The primary cause of heart disease is not in fact cholesterol, but it is inflammation. If we have an inflammatory response, that is going to be a major problem in our body. Now, cholesterol will never clog your arteries unless you're inflamed. We see these commercials on TV where we get this plaquing and they get you all nervous that you're going to get plaque built up in the arteries. That doesn't actually happen. What ends up happening is the plaque actually gets into what's called the interstitial lumen. So it's not where they show you on TV where it's around here. It's actually in between. And that's only going to happen if you do have inflammation. If you don't have any inflammation present, that will not happen. You need cholesterol to form proper nerve and brain functions. If you don't have cholesterol, cholesterol is not the enemy. If you don't have cholesterol, you're going to have problems. Now, there are other factors involved with peripheral neuropathy. So if you've suffered a damaged low back, this can also contribute to peripheral neuropathy. Things like stenosis, degenerative and bulging discs, degenerative arthritis, these all have one thing in common. They're going to have a common trait of damaged or low back. So your lower spine is compressed, and what this does is this is going to place pressure on the nerves that go down into your hands and feet. You might have heard of the sciatic nerve. Well, the sciatic nerve is the largest nerve that you have in your body. And as it comes out here through the piriformis, if there is compression on that from the piriformis muscle, then that can cause problems coming down here in the sciatic nerve and throughout the legs. Now, diabetes and insulin resistance. Nerves need a lot of energy to survive. Glucose is the main source of that energy. But if that glucose gets out of control, that's going to lead to secondary problems. Insulin is a hormone that puts glucose into the nerve. Insulin is produced by the islets of Langerhans in the pancreas. And once that hormone is released along the nerve, when you're diabetic, if you have too much glucose, then that is going to lead to peripheral neuropathy. When you're diabetic or insulin resistance, glucose can't get adequately into that nerve. So it's going to give you that numbness, that burning, that pain, tingling. You might even have some weakness there. Chronic inflammation. You cannot build a house if it's on fire. What are you going to do with your body if it's chronically inflamed? If you're constantly trying to battle this inflammation and trying to do all kinds of other things to stay healthy, but you don't address the inflammation, it's like trying to build a house that's on fire. You might get the little piece of it built up, but it's just going to burn down again. It's going to be a chronic, debilitating thing that's going to keep going on and on until you address the cause of the problem. Some common causes of inflammation that contribute to peripheral neuropathy include food sensitivities. So one of the best things that I recommend for all my patients is replacing your standard American diet with a paleo diet. The paleo diet is going to eliminate certain things. It's going to eliminate gluten, dairy, and soy. Those are the three major foods that cause an inflammatory response in your body. Hidden gut infections, poor omega-3, omega-6 essential fatty acid ratios. If you don't have enough essential fatty acids, then that is going to lead to peripheral neuropathy as well. High insulin, too much insulin being released, and hormone imbalances. We want to make sure that we have a good combination, a good balance of good fats and bad fats. We don't want to have all bad fats, because if you're doing that, if you're eating things like pizza, if you're eating burgers, if you're not getting any of these good fats, then that's going to be a problem. Metabolic causes need to be addressed if you're going to win this battle against peripheral neuropathy. So how do we know what to do? Well, first and foremost, what we want to do is blood work. We want to see what is going on with your body. When we look at specific lab ranges, they have a tendency to be inaccurate. If you think about how they come up with all of their data throughout the year at a lab, the way that they do that is they use a bell curve. They're going to take a list of all the people that came into that lab throughout the year, and they're going to use that in order to come up with their ranges. Now, a functional lab range is going to be a lot more sensitive. It's going to be a lot tighter gap, and that's going to reveal problems a lot easier than the traditional pathological range. So that's why a lot of times you might see that your lab tests are normal, but you're still feeling sick. As opposed to looking at the abnormal low values and the abnormal high values, we want to be looking at the functional lab ranges. These are a lot tighter. So if you have a glucose reading of 85 to 100 milligrams per deciliter, that is where it should be functionally. If you have a blood sugar level around 60 or 65, your doctor may tell you, well, it's a little low, but there's nothing we should really do about it. We'll just monitor it, And if it's up around 120 or 130, well, you're not diabetic, so we'll monitor it, and once you become diabetic, then we'll put you on medication. I don't understand the logic behind that. Why would we not address it if there was a problem? If you're not in that functional range, we want to do everything we can in order to make sure that you don't become diabetic, or that you don't have thyroid problems, or that you don't have the wrong triglycerides or hemoglobin. We want to make sure that we're in that proper functional range. So, when you can't feel your feet, what happens to your brain? If I ask you right now, if you have peripheral neuropathy and you can't feel your feet, where do you feel the problem? Is it in your feet? It's not in your feet. It's in your brain. All pain is perceived in your brain, specifically in the parietal lobe, which is an area over here, and a little strip that we call areas 3, 1, and 2. This brings all somatosensory information. So all information that we're going to feel, that's all perceived in our brain. It's not perceived in our foot. So we've got to make that correlation between the brain and the rest of the body. Now, there was actually a study done here, peripheral neuropathy, differential diagnosis of management. If you cut your nerve, change your brain study. So if those nerves are going to be damaged, what's going to happen is you're going to have a loss of balance, memory loss, depression, anxiety, could lead to Alzheimer's, dementia, and insomnia. This is not just an isolated thing. When those peripheral nerves are damaged, then there's going to be damage associated with the brain as well. In our brain, we have what's called the somatotopic map. So in this map, this gives us an idea. This is a cross-section here of our brain. So this is going to give us an idea of where everything in our body lies. For instance, we have our leg, we have our hand, we have our eyes, our mouth. Things like our thumb are very largely represented, and our low back is extremely small. That's why when you have low back problems, they have a very difficult time healing because they have such a small somatic representation in our brain. When we look at something like the thumb, on the other hand, it heals relatively quickly. Think about if you hit your thumb or jam your thumb, somebody might be playing football and they hurt their thumb, it heals relatively quickly. It's because it has a very large somatotopic representation in our brain. Now, what is the neuron? What does that need to survive and repair? It needs two things. It needs fuel and activation. So fuel is going to come in the form of glucose and oxygen. And activation, what we're going to need is a lot of movement and input into the body. We want to make sure that we have no inflammation, because the more inflammation we have, as we've been talking about throughout this entire video, the more problems we're going to be associated with. Activation. We need lots of activation, whether it's exercising, whether it's going through specific brain-based therapies. All of this is activation into your brain. You've heard the term, if you don't use it, you lose it. That is really, really true. Because if your brain is not functioning, if you don't have enough activation into your brain is not going to be functioning properly. Now, what else can we do in our office to help you as a patient with peripheral neuropathy? Let's look at some of those. First and foremost, one of the things that we're going to use is what's called a class 3 low-level laser. This is also known as a cold laser. How does a class 3 cold laser repair the peripheral nerves? Well, it sends a specific wavelength of light. This is not longer than 800 nanometers, and it's been proven to get into the cells and actually stimulate energy production inside the neuron, allowing the neuron to heal. Now, this light also stimulates microcirculation and lymphatic drainage. The light has to be coherent. That means that it can't scatter when it hits the tissue. It has to be focused. It's going to decrease in pain intensity. It's going to show you improvements in pain, range of motion, and functionality. It's going to improve microcirculation. It has the capacity to regenerate tissue, and the most important thing to me, it's safe. Now, what else can be done to activate and repair the nerves? Well, peripheral neuropathy rehab therapy, also known as a rebuilder. this is actually going to help rebuild the axon part of the nerves. So when we have a loss of what's called large diameter afferents, these are the nerve pathways that are bringing sensation to the back part of your brain. Guess we're having a fire somewhere down the street here. So this brings information to the back part of the brain at about 275 miles per hour. But as we lose that ability to feel, we're also going to lose our ability to inhibit pain. So this rebuilder, what it's going to do is it's actually going to wake up these large diameter afferents and allow you to feel more. Not only is that going to help, but it's also going to decrease pain globally. So not just pain in your hands and feet, but throughout your entire body. So we use the peripheral neuropathy rehab therapy, class 3 low laser. We're going to use vibration with oxygen therapy. Vibration is an extremely powerful tool to your little brain, the cerebellum, and this is really going to help with the healing. So it's going to stimulate the large sensory nerves in the feet while we deliver oxygen. We also want to make sure that your pH is balanced. If your pH is not balanced, if your pH is not between 6.4 and 7, you're putting yourself at risk for any kind of illness. Now, the rest of our program includes using things like essential fatty acid cream. So this is also going to decrease inflammation and decrease pain. Nitric balance. What nitric balance is going to do is it's actually going to dilate the capillaries. We talked about the end of the capillaries, the most distal nerves and arteries that are being affected. Every time that we have an artery, they're going to run together. We have a vein and an artery and nerve that run together. So if those arteries are affected, we want to make sure that we dilate them so enough blood flows to the area. So nitric balance is going to be a product that's going to help that. Now 80% of our immune system is in our gut. If our gut is not functioning properly, if we don't have enough stomach acid there to break down the food that we're eating and pull those nutrients out of it, then that food can actually sit there and rot, or it can leak out into the rest of the body. That's called leaky gut syndrome. So if 80% of our immune system is in our gut, we want to make sure that you do not have hypochlorhydria. And what that is it's a lack of stomach acid in your stomach so that you're not able to break down that food. We want to make sure that there's enough stomach acid there to maximize your healing. If 80% of your immune system is in your gut, then we want to make sure that that 80% is functioning properly. Some other supplements we would give you would be based on your blood test results, should we have to order those. Now, some of the key points to take away here is there are different things to do in order to correct peripheral neuropathy. It's not just doing one thing that's going to help it. You've got to address both the underlying and the underlying metabolic and neurological problems, not just one or the other. This is a condition that is progressive. Our peripheral neuropathy program is the most comprehensive state-of-the-art program that exists right now in Chittenden County in Vermont. I go through this myself. I'm diabetic. I have been type 1 diabetic, insulin dependent since 1987. I go through the effects of peripheral neuropathy on a daily basis. So I have to do whatever I can in order to help people. So when you come in here, this is not just someone preaching at you. I understand what you're going through. I go through it as well. And I do everything I can in order to make sure that I can keep my limbs functioning properly and that I can keep my limbs. Now, in summary, we're going to do some comprehensive blood work to look at functional ranges to identify any underlying metabolic conditions that might be causing your peripheral neuropathy if we don't know what it is. We're going to place you on an anti-inflammatory diet to allow healing. We're going to use peripheral neuropathy healing and nerve activation via PNRT, class 3 cold laser, a vibration therapy with oxygen, EFAC cream, and other supplementation that are going to help you specifically. Now, how bad are you? The initial exam is going to include a comprehensive and complete neurological exam. We want to see how bad those nerves are. So what's next? The next thing to do is to make an appointment. I can't do anything if I can't see you. The first 2 visits. The first visit when you come in, I'm going to do a complete neurological evaluation. I want you to bring in any additional tests that you have, and we'll review those as well. I'm going to have you fill out a specific form called the metabolic assessment form. You can get this online, or you can call our office and we'll send it to you. I really can't stress this enough. It's very important for your spouse or significant other to be there with you, to see the examination, to help you, to be there as a person to lean on in this time of need. On your second visit, if I accept your case, I don't accept everybody as a patient. I only want patients that are willing to do whatever they can in order to help heal themselves. Now I'm going to overview any further complete testing that has to be done. We're going to review your neurological findings from the first day, and then I'm going to go through my treatment plan and I'm going to give you my best recommendation. We're going to review any kind of financial obligations that are there, and for this, it is absolutely mandatory that your spouse or significant other is there. You would never go out and buy something without your significant other, or go and get yourself involved in any kind of treatment plan without first discussing it with them. I want you to be there to get the information firsthand from me and through the exam, and so that you could know exactly what's going on, so that you don't have to sit there and say, I'm not really sure what he meant or what he said or how he can help me. Now, what else do you need for your first appointment? Bring a pair of shorts or sweatpants and a t-shirt. Something that's going to be loose, because I have to be able to have access to your arms and your legs. You must have all your paperwork filled out before you come in. And bring your spouse or significant other with you. Now, I only accept about 5 new peripheral neuropathy patients a month. This takes a lot of time to come up with these programs and be able to treat you. Now, there are some rules when I accept a case. You must be willing to make serious changes, and you have to take accountability for your life. This is not the government's responsibility. Your health is not up to your state. This is not up to your work. This is not up to your insurance company. It's up to you. You're the one that has to do this, and you have to be willing to make a change. Now, insurance and Medicare might pay for a small portion of it, but we do make it affordable so that 96% of the people who we see can get the care they need for as little as about $200 a month. Now, here's some things to think about. On a scale of 1 to 10, how serious are you about your illness? Where do you see yourself in 3 years if nothing changes? Now, how has this affected your relationships? How has this affected you at work or at home, or your ability to enjoy life? Now, think of 3 things that you couldn't do or that you would love to do if you did not have peripheral neuropathy. So if you didn't have this problem, are there 3 specific things that you would love to do? On a scale of 1 to 10, how important is this for you to eliminate this problem? Now, due to time constraints, I can only accept those people that are absolutely willing and are committed to getting healthy. So when you're ready, go ahead and give us a call. The phone number is area code 802-230-4678. You can also send me an email to drtager@gethealthyvermont.com if you have any additional questions. So once again, I thank you for taking the time to watch this video about peripheral neuropathy. I can't preface it enough. I know what you're going through. I go through it myself. If you want somebody who understands you, who knows how this can help and what can be done in order to get you better, please give my office a call. We'll sit down, we'll talk, we'll do whatever we can to help you. Thanks for watching this, and have a great day. Bye-bye.